Good afternoon, everyone. My name is Blessing Ajufo, and I present to you the substance use presentation with the fentanyl abuse in the United States. Fentanyl is a synthetic opioid medication medically used for severe pain, especially after surgery, and used with cancer patients. It is much stronger than morphine and heroin, so just a little amount of it can cause respiratory depression and as well can lead to death. Many people overdose on this medication, possibly because maybe they don't know some medication that they are taking actually have some fentanyl in it. And some people just kind of overdose on it basically because of the dependence tendencies as well. Fentanyl was first synthesized in the 1960s by Dr. Paul Janssen, a Belgian chemist and the founder of Janssen Pharmaceutical. In the year 1990, I think, according to research, the patch form of it was produced to help with cancer patients dealing with pain. And in the 2000, it was found that the drug traffickers actually started mixing this medication, fentanyl, with some heroin in producing some counterfeit pill and being used as street medicine. That is not the purpose of it, but is one of the reasons why fentanyl become like one of the medicine that is used on the street, and that is one of the causes increasing the abuse of this medicine, leading to people losing their life because of the high potency of this medication. Illicit fentanyl is now found in heroin, cocaine, methamphetamine, and counterfeit medications. Many overdoses are polysubstance overdoses, which makes assessment and harm reduction planning even more important. We cannot just generalize that people taking fentanyl are aware of what they're taking. Some do not know at all that whatever they're taking has fentanyl in it. And as a result of the high potencies of this illicit medication, from research, it has been proven that deaths have really surged recently due to the availability of this illicit fentanyl. The opioid crisis remains a significant public health issue in the United States, and the struggle is really real. Risk increases when substance exposure overlaps with pain, trauma, mental illness, unstable living condition, or counterfeit pill use. Individuals experiencing homelessness or economic instability are one of the risk factors in vulnerable populations that have exposure to this illicit fentanyl. Adolescents and young adults experimenting with recreational drugs as well might be exposed to this fentanyl misuse. Individuals using drugs unknowingly contaminated with fentanyl. Like I said earlier, not a lot of people know that medication that they're taking off the street contains fentanyl in it. People with the substance use, like I said a little bit earlier as well, when it overlaps with pain and trauma, all of these people are vulnerable population that are exposed to this illicit fentanyl. The short-term effect of this fentanyl use can range from euphoria to intense sedation, from pain relief to drowsiness and confusion, nausea, constipation, slow heart rate. Sometimes you can have like pinpoint pupils and slow breathing, as well as loss of consciousness in overdose. Long-term opioid misuse can also significantly impact relationships, employment, and overall quality of life. He actually, when you take fentanyl for a very long period of time, it gives that you build tolerance for it, and at some point, you become dependent on it. Emotionally, physically, you become so dependent on it that it seems like one can function without it. Long-term effect of fentanyl abuse can cause depression, anxiety, and cognitive impairment. Of course, social decline, and it can cause infectious disease when being injected, because sharing of needles or injecting the same needles over and over again can actually pave way for infection to get to the bloodstream. Signs and symptoms of abuse. Like this picture is depicting this person showing in the picture to my right. It looked like they're wasting away, even with the drugs in front of them, they can't do anything. So you can see somebody, you see them on the street. Some will be standing in, they don't even know where they are. They've lost consciousness at some point. These are the signs of abuse: extreme drowsiness, slow speech, impaired coordination. Um, they become drug seeking, to the point where if they don't take it and they get into that withdrawal syndrome, the withdrawal symptoms, they become delirious at some point. And sometimes, if it's really to the point, they can get like pinpoint pupils where you have to give a reverse of this drug for them to come back to their right self. So yeah, it is really a big problem in the United States with all this illicit drug on the street, and people finding themselves, taking taking all these drugs and causing them more harm than good. Now, because fentanyl is highly lethal, it may be used intentionally in self-harm or suicide attempt. Suicide risk assessment is essential when a patient presents after overdose, severe depression, hopelessness, or repeated risky use. Overdose risk rises further with alcohol, benzodiazepine, and other sedatives. And at the same time, like I said in the previous slide, some of these street drugs contains fentanyl because of the highly potent tendencies. They mix fentanyl with the street drugs without individual even knowing what they're taking, which makes it a very high, extreme, um, dangerous, drug when being misused. The care plan alongside with the pharmacological treatment. First of all, you have to stabilize the patient and make sure that the individual
is ready, assess for readiness for treatment as well. You have to set a goal. The goal is to reduce overdose risk and strengthen follow-up. And thirdly, you have to treat, start evidence-based medication and supportive therapy as appropriate. And on the fourth side, support teach the use of naloxone, use provide resources and involve support when appropriate. Monitor this patient so the relapse does not recur. Um, Overall care plan, you just focus on the safety, medication for over use drug plus therapy, patient education plus recovery support, as well as reliable follow-up. And like I stated in this slide, um, some of the medicines that are used for treatment, like the buprenorphine, it helps reduces craving and withdrawal symptoms. The methadone, um, the naltrexone, and as well as the naloxone as well. All of these together work as a pharmacological treatment for um, helping a patient come off this illicit drug use slowly and steady. Non-pharmacological treatment for um, drug users, CBT can never be overemphasized. You being able to talk through the situation and hear somebody, guide you through step by step, like taking your hands, like we are in this together and helping you through every situation is one thing that has helped with just not drug abusers, but with any form of psychological difficulty. Motivational interview as well is one that can never be overemphasized as well. Um, support groups are very, very great. I remember during one of my clinicals at a time where we went to a group, and you can see how this group have been so supportive with every individual that are there and not being judgmental of anybody at all. So they're gonna benefit from the any group as well. I think the one for opioid use is called the any narcotics is called the any group. That's Narcotic Anonymous, and as well as the family involvement when appropriate. Um, at the same time, this individuals needs to be educated. Some of them don't know any better, so continuous education and numbers to call in just in case they become, it gets out of hand where they become maybe suicidal or they having thought of or any or homicidal ideations. So this number to call, like the 988 911, keep educating them, and above all, referral, making sure whatever difficulty they're facing that is contributing them to be on the street, housing, insurance, transportation, and so on and so forth can be taken care of. And we've seen cases where they be like, I'm ready to come off, and genuinely, and they walk through it and they become sober after a while. Yeah, like I said in the previous slide, patient education is very important, referral and follow-up as well. This is to avoid any unforeseen occurrence or to avoid any thoughts that premeditating thoughts, and avoid it being coming to reality, about self-harm. Yes, so Referral is good. For social support services, you follow up on appointment with these patients and yeah, check their progress and see where they're at every time. In conclusion, fentanyl is one of the most dangerous substances in the current overdose crisis because of its potent, often hidden and commonly mixed into other drugs. And assessment must include overdose risk, co-occurring psychiatric symptoms, trauma, and suicide risk. Recognizing signs of opioid misuse and overdose can save a life. Psychiatric mental health nurse practitioners play an important role in harm reduction, treatment engagement, and long-term recovery support. Thank you.